Hello, everyone. My name is Nida Shahid, and on today's episode of Persivia Perspective, we have Usama Sajjad here with us, who is our Senior Business Analyst at Persivia. And we are going to be talking about something that has been bothering most of our clients and how we can solve this issue, which is how accountable care will drive VBC for all populations. So, Osama, my first question to you is that with ACO REACH winding down in 2026, MSSP is being seen as the next big chapter. What are the
Mhm.
critical changes organizations should prepare for?
So
Thank you.
the very first thing is that for now, CMS, in case of MSSPs, is allowing the new entered ACOs to stay in one-sided risk model for 7 years and is on two different agreement periods. But moving forward from 2027, this will be a single agreement period of 5 years where an ACO can stay in a one-sided risk model, and then the ACO is supposed to move to the two-sided risk model. The other big thing or a big change is CMS is providing some flexibility in ACO programs, which is related to eligibility. Currently, the eligibility criteria for ACO is to meet at least 5,000 beneficiaries per year in first 3 years of the performance period. But moving forward from 2027, it will be only for 1 year, which is the benchmark year three. Any ACO who will meet 5,000 beneficiaries in total, in terms of eligibility, that ACO will be eligible to be continued for their program with ACOs. Also, CMS is increasing the quality reportings for ACOs in 2027, which will be 9 measures. And then in 2028, the number of measures will increase to 11. That's also a big change. CMS is changing the primary care definition, where for now, CMS does not include the behavioral health integration and psychiatric collaboration care management. But after 2027, those will also be part to consider as the assignment or the attribution. So these are some big changes that we are expecting in ACOs for after downsizing of the securities program.
Thank you so much for answering that, Osama. So, my next question to you is what does staying ahead of this MSSP shift really mean for leaders of ACOs and health systems?
Okay, so as I mentioned that now moving forward from 2027, CMS or any ACO program will only have like 5 years for one-sided, so they should really be focused on to move toward the two-sided risk model or to pay their attention toward how to manage their ACO before the time comes to go to the two-sided risk model. Also, the one thing that will greatly impact to any ACO will be like their focus should be on improving the care transitions, and then then they should reduce the avoidable emergency department utilization. Also, they should ensure the accurate and complete HCC coding to appropriately capture the illness of your population. So these are some major points that we should do as an ACO entity. Uh, there is one more thing that now, if we talk about the claims data for ACO, which is usually on lag of like 3 to 4 weeks, we should move to some real time data instead of like a data which is on lag to analyze how the patient is behaving and how a provider or an entity should react. I mean, in other words, if I say we should be proactive instead of like a reactive, so that's a very big change that we need to do on our analytics part as in healthcare of US. And for that, surely we do need to build some structure where we will have a streamline of data. Instead of just uploading or loading or processing the claims data, we should have like different modes of data. For example, we should be able to get the data from EHR, and then we should have the STOH details, and then we should have the details on labs for single patient. So these are some things that needs to be looked upon in US in moving forward in at least in ACO to get some better outputs for MSSP programs.
Thank you for explaining that in detail. Now, my last question to you is that we claim that, as Persivia, our care space unifies data from multiple sources to help ACOs close care gaps and reduce the provider burden. So, how
Hmm.
important is this type of integrated approach in achieving MSSP goals?
Okay, so the very first and very important thing that Persevia has been doing from the past 20 years is the data aggregation, which includes that Persevia process data through different modes, which includes like claims data, and then the EHR data and HREs, the labs data, and create a unified longitudinal patient record, and provider can easily view those single records or each detail related to every patient at one point, and that's a very big thing. The other main point is the closing care gaps. So in Persevia, by consolidating these data points, different data points, system can instantly identify missing patient services and like for example, the chronic care plans allowing care teams to intervene proactively. Like I mentioned, instead we should be proactively instead of reactively. So this is what Persevia is giving to the healthcare of US. In terms, if we discuss about the financial performance, how Persevia is working in financial performance, so using AI and NLP, an advanced platform can analyze unstructured physician notes, and it's a very basic thing that Persevia using AI can analyze and capture some correct SEC codes from the unstructured notes written by providers. In the same way, the complexity of expanded APP measure set, especially with the push of for ECQMs, requires an automated system. It's not simple thing to do. An integrated platform streamlines, quality data submissions, reducing manual burdens on staff and improving accuracy of reporting. So these are some big things that Perceive has been performing from a very, from 2 decades, and also working to improve their efficiency as well.
Thank you so much for answering all of my questions in such detail, Osama. And just to add a note to all of our viewers, Persivia is coming to NAACOS Fall 2025 conference from 8th to 10th October. So you guys can also stop by Booth I to learn how Persivia can help your organization thrive in BBC. Thank you so much for doing this, Osama.
Thank you so much for having me on Persevia Perspective.